The robot in the OR. Is it miracle? Is it marketing? Or just really expensive furniture? The surgical robot, this giant, shiny transformer that costs more than a luxurious condominium and somehow still needs yearly software updates. Is it a masterpiece of precision, or is it the world's most glamorous medical accessory? Let's start by talking about what the robot really is and actually what is not. And let me start by clearing something from the beginning. The robot does not operate by itself, thank God. The robot basically is a high-tech tool with a fancy arm, does nothing unless I move my hands. Think of it like I sit on a console away from the patient that control the robot. That console can be even in the other room, in another country theoretically. So maybe one day we'll operate on a Chinese patient from the United States, hopefully not the other way around. I move my finger, the robot that is against the patient table has its little arm and it copies me, but smoother, steadier, and with a zero caffeine shake. It gives me a tiny instrument that moves like a wrist inside the patient's body, a 3D extremely high definition view that looks like I shrunk myself and walked inside the abdomen or the chest. It's super steady because this machine doesn't sneeze, doesn't get tired, and doesn't complain about the OR temperature. So no, it's not a surgery replacement. It's more like giving your surgeon superpower, better vision, better precision, an instrument that can turn in a way the human hand physically cannot. And the whole time, every single moves come from the surgeon. If the surgeon stops, it stops. It's the world's most obedient assistant, of course, without an attitude. Where the robot is a total superstar, there is surgery where the robot is not just helpful, is a complete game changer. In the deep, narrow area, like very lower pelvis for the lower rectum, for the prostate, for the upper abdomen near the cardia, and the lower esophagus, these spaces are very tiny. So it's like you are doing your shoelace inside a Pringle can without bending your elbow, where it's easy to it for the instrument to move, and it's very difficult, maybe impossible, for my hand to do. Same move where the robot shines. Better angles, better visibility, better control. And in those cases, yes, robot surgery can make a huge, meaningful difference. This is where the hype has real muscle. But some surgeons use the robot for everything. Appendix, robot. Gallbladder, robot. Hernia, robot. Tie shoes, maybe they will ask for robot. I'm wondering, are they doing this because it's better? Or because the robot costs millions and someone need to justify the payment? Or maybe, just maybe, to collect hours like pilot who need flight time. Here the problem no one talks about, the learning curve. Let me tell you something patients rarely hear. Using the robot well takes practice, a lot of it. And here's the truth, a surgeon doing their first 20 robot cases is not the same as the one who's doing his 500s. A robot in the hands of a beginner is not better than a skilled surgeon using laparoscopic. That's the truth hospitals don't put on the billboard. So is this a marketing or a reality? The incision myth. Hospital market robot surgery like it's premium care, the Lexus of operation. But here's the secret. Many robotic cases use the same number of incisions, the same size of incision, the same recovery. Sometimes the only thing bigger is the bill. What is the hidden cost that nobody sees? Let me tell you about the part nobody want to talk about it. Disposable robotic instruments. These tools, they are single use. You use and throw away. Every case, new instrument. Ching ching. That money doesn't magically evaporate. It lands right on the healthcare system, on the insurance premium, on the society, and of course at the end on the patient. Do hospitals make money on it? That's the million-dollar question, literally. Sometimes laparoscopic is faster, cheaper, and just as good. For many common procedures, hernia, appendix, gallbladder, there is no proven advantage to the robot. In fact, laparoscopic is often faster, cheaper, and just as effective with equal or fewer complications. So again, the tool must match the patient, not the other way around. The real secret here, choose the surgeon. Choose the surgeon, not the tool. This is the most important thing you will hear all day. The procedure should not fit you, not the surgeon's habit, not the hospital marketing, not the robot payment schedule. You want a surgeon who can do it. Laparoscopic, robotic, open, and who choose the right one based on your anatomy, your disease, and your safety, not convenience. It's like going to a restaurant and you don't want the chef who only cooks soup. You want a whole menu. At the BenMaamer Institute, that's exactly what we offer. Robot, we have it. Laparoscopy, we have it. Of course, open surgery, absolutely. The procedure fits you. That's how it should be everywhere. This is the honest, simple truth. So if the robot, is the robot amazing? Yes. Is it sometimes overused? Yes. Does it have a place? Absolutely. But at the end of the day, the most important technology is in the operating room is still the surgeon. So ask question, know your option, and choose the surgeon who has all the tools and the wisdom to use the right one. Because someone has to tell the truth before the robots learn to talk. What do you think?